Come in. Hi, Haley. How are you today?
Good.
Good. My name is Heather, and I'm going to be your nurse today. And what brings you in our office today? Are you here for your checkup? All right. So what we're going to do today is called the head and neck assessment. What I'm going to do is I'm going to check your scalp, your ears, your nose, your mouth, and your throat. And I'm also going to check to see in this area around your throat, your lymph nodes, if there's any swelling present, which could be a sign of infection, okay? All right. But before we get started, I'm going to wash my hands, and then we'll get started on your assessment. Okay. All right, Miss Haley. The first thing we're going to do is I'm going to check your scalp. Is that okay? All right, let me have you look over here to your left for me. What I'm checking for is to see if there's any signs of any lice, hair loss, any abnormalities in your scalp. I don't see anything. Your hair looks full and thick. It's got a good shine to it. Have you had any problems with your hair or anything like that? Any hair loss? Okay, let me have you look up for me. The next thing I would like to do is I'm going to check your eyes. So let me have you cover your right eye for me and read the back wall for me.
A-M-H-J.
Okay, cover your other eye. Read it backwards for me.
J-H-F.
You can't see the last letter?
Is it A?
Try it one more time for me. Cover your left eye.
J-H-F-A.
Good job. Looks like you have a little bit of a problem with your your right eye. So we'll have the doctor look at that a little bit further, okay? Now I'm going to do a pen test. What I need you to do is follow my pen for me, just with your eyes. Okay, good job. The next thing I'm going to do is I'm going to check the black part of your eye called the pupil and make sure it reacts to my pen light properly. Okay, pupils reacted great to the pen light. Now I'm going to look at the white part of your eye, okay, to see if there's any redness or anything like that. Let me have you look up for me. Good job. There is a little bit of redness on the sclera, which is the white part of your eye. That may be because you're sleepy today or because of some allergies, okay? Now, I would also like to do a field test for your vision. I'm going to place my hands behind you and bring them forward. When you see them, you just point your hands up, okay? You ready? Good job. I haven't pointed yet. You got to watch my fingers. You ready? Good job. You reacted normal to that. Your vision seems to be okay. It may be that you were tired, maybe why you had a little bit of trouble looking at the eye chart today. So we'll test your vision the next time you come into the office, or if the doctor wants to send you to your eye doctor, we may do that as well. Now, the next thing I want to go ahead and do is check your nose. I need to make sure that everything is normal inside your nose. I'm going to use my pen light to look inside. Okay, mucosa is normal. It's pink. I don't see any swelling or inflammation. Both nostrils look clear. I'm going to close one nostril. You blow out of the one that's open. And then I'll close the other one and you'll do the same thing, okay? Here we go. All right, your left nostril does sound a little bit stopped up. I'm going to go ahead and feel your sinuses, okay? I don't feel any swelling in your sinus area. Are you having any trouble with your breathing right now? No? Just a little bit of stuffiness in that one side? Okay. I'm going to go ahead and check your mouth to make sure everything looks normal there. Let me have you open up. Okay, soft palate and hard palate look normal. Your mouth is moist, which is good. I don't see any signs of any ulcers or any bumps inside your mouth. Stick your tongue out for me and look. Okay. Your throat looks good. The little hangy ball in the back of your throat is called your uvula, and it is pink and moist as well. I don't see that there's any abnormalities in the back of your throat. So let me go ahead and do your ear test. I'm going to whisper my fingers like this, and you're going to listen for it. When you hear it, you let me know.
Yes. Yes.
Okay? One more time.
Yes. Yes.
Good job. I'm going to look inside your ears to see if there's any drainage or abnormalities. Good. Good job. Let's see. Ears look normal. I do not see any signs of drainage or inflammation, which is good. You've been cleaning your ears? Good job. I'm going to check for symmetry of your eyes, your nose, and your mouth in conjunction with your ears, okay? Have you look straight for me? Okay. Everything looks symmetrical. Now I'm going to have you open your mouth for me and close. Open, close, close. Good job. Your joints are working right here in your jaw. That's a good thing. That helps us to chew our food better. The next thing I'm going to do is I'm going to use my stethoscope and I'm going to listen to your arteries, okay? First one I'm going to do is going to be on your temple. Now I'm going to do your throat. Good job. I don't hear any bruise or anything like that. Everything sounds normal. Now let me check your pulse. Okay, your pulse is normal. Next thing we're going to do is called the range of motion test. So what I need you to do for me is take your chin and pull it down to your chest. Good job. Now let me have you ease your head back. Good job. Look over your left shoulder. Look over your right shoulder. Take your left ear and pull it down. Your left ear. There you go. Now your right ear. Good job. Next thing, oh, did that hurt a little bit? Let me feel here. That hurts your neck? Where at? Can you point to it? All right, let's feel for that and see what may be going on. Put your hair back here behind your neck here. Now have you put your feet out straight for me? And sit up tall. There you go. Does it hurt right here? Okay. There's a little bit of swelling right there. It may be like a pulled muscle or something like that. Do you play softball? Okay, it may be because when you threw the ball or you batted today. Did you have practice? Okay, that may have aggravated it just a little bit today. So we'll take a look at that when the doctor gets in the room and he'll let you know what to do for that. Okay? All right, next thing I'm going to do is I'm going to feel around your neck and see if I can feel any abnormal bumps. Let me know if at any time you have any pain, pressure, or discomfort. You okay? Okay. Now I'm going to give you a cup of water, and when I do that, I need you to turn around for me. And I'm going to see how your throat does when you swallow. I'm going to check and make sure all your cartilage and everything is working, okay? Take a sip. The cartilage helps us swallow our food and water, okay? And we have you turn your head to the left and swallow, and turn to the right and swallow. Okay, good job. Normal movement. Okay, may I have you turn back around and face me, please? Uh-oh, you almost flushed it out there. Okay. So I believe that is going to be everything that we need today for the doctor to look at. And then we'll go ahead and get you scheduled for your next well check. Okay, thank you, ma'am.